This is the BestHealth Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Hey, good day, everyone. Welcome back to the latest episode of the BestHealth Podcast, brought to you by Wake Forest Baptist Health. Justin Gomez here, and I have a guest that's beginning to become one of my favorites. Dr. Steve Scoggin is joining us again as we continue our series about mental health awareness issues and helping people recognize and identify and work through some of what they might be experiencing as we go through the COVID coronavirus pandemic. And we have, been thrown all these new definitions of social distancing and shelter in place at home and virtual learning for the kids. So it's a whole new world and schedule for us. And Dr. Scoggin is here to help us process through that once again, and we really appreciate that. I will say, just at the beginning of these COVID-19 related podcasts, I want to give everyone the opportunity, if you're looking for more general information about COVID-19 and what Wake Forest Baptist Health is doing and what questions you might have, feel free to go to wakehealth.edu/coronavirus, wakehealth.edu/coronavirus. And we have all kinds of information, FAQs, clinic updates, myths versus facts, lots of good information, as well as all of these podcasts as well. So Dr. Steve Scoggin, as I mentioned, if you've listened to maybe one of his previous podcasts that he's done with us, he's been a guest a few times. He's the Associate Vice President for Behavioral Health, and he's the interim chair for the Department of Psychiatry and Behavioral Health for Wake Forest Baptist Health. So welcome, Dr. Scoggin. I appreciate you coming back and joining us.
Justin, thanks for having me, and thanks to you and the Best Health team for these podcasts. I've gotten so many emails about the variety of podcasts that y'all been offering our health system and community. So thank you for the great work you and your team have done.
Well, thank you so much. We appreciate that, and I know you're very busy these days, and want to just talk to you for a few minutes. And I thought this topic really struck me as interesting because what we're going to be talking about today is grief and the grieving process, and in the context of COVID-19 and coronavirus. And what we usually hear in terms of grief is surrounding, possibly the death of a loved one or a family member or someone we care about, and or some sort of other monumental loss that is causing us to grieve. And I really want to, it's really interesting, I want to dive in here and have you help us understand what we might be feeling out here in the community. One of the things that we might be trying to process and maybe haven't identified it ourselves is grief, and going through some sort of grieving process with just the way our lives have been turned around and upside down about just with all the shelter in place, and maybe some people aren't working, they're furloughed, et cetera, et cetera. And this could be really insightful. So I guess it would be great just as a baseline for you to help us understand just kind of a good definition you all use in your clinical environment when you're working with patients. Just give us a baseline, almost definition of how you guys define grief and how you help people identify what maybe that's what they're experiencing and going through.
Yeah. Well, thank you, Justin. You named it well. We usually associate grief with death or the loss of a loved one, but the truth is we go through griefs all our lives, all of our life. Mm-hmm. We grieve small losses when our kids leave the home and go to kindergarten. That's not a bad thing. Grief is not always a bad thing, but nevertheless, it's related to a loss that we feel. So we have all these accumulation of many losses throughout our lives. Grief is just our natural body and mind's response to losing something real or imagined.
Okay.
And so it's important that we go through those griefs, because the way we go through the small griefs in life has a lot to do with how we deal with the larger griefs, like the one
Mm-hmm.
we're dealing with right now, which could involve the loss of someone that we know to COVID-19 or someone close to us, but it also has to do with the things you're naming, the loss of routine, of what we consider normal, the loss of the cadence of our lives, things that we take for granted, like you named social distancing. I'm trying to correct myself these days and say physical distancing, because I haven't really distanced myself socially from anyone,
Yes.
but I certainly have physically distanced myself. So
Yeah.
that seems to capture better for me what's really going on. So grief is just a natural response that we all go through. There's a bodily response as well as a psychological response when we feel a sense of loss that sometimes we can name and other times we can't really name at all.
Yeah. Well, so I guess help us put into context. Maybe we've talked a little bit about managing stress and managing anxiety, and we've talked a little bit about depression and how that might be some of what people are going through and what they're processing through. So how does grief differentiate between some of those things that we've already talked about, and what's the best way for us to look to maybe identify that we are going through some sort of grieving process? And I guess this will help us, once we identify it, help us to process through it, correct?
Yeah, that's a great question, Justin. When we talk about like depression, anxiety, we're usually talking more about clinical presentations of affect and a set of symptoms. Grief is a process. It's certainly activated by stress, the loss of something.
Mm-hmm.
It's not necessarily a clinical syndrome, although if you do not work through your grief, it can become what we call complicated grief.
Mm-hmm.
It can have a clinical symptom effects, but grief is more of a process that we identified actually back in the 40s and 50s after a horrible fire, the Coconut Grove fire, and the massive loss that people experienced in that community. We saw people after that fire who lost loved ones go through this process, and we started understanding this as a grieving process that had natural and normal stages to it.
Mm-hmm. So what do we do to process through grief? Do we just kind of wait out the situation and till the situation changes, or what are the different maybe steps, if you will, to go through how we go through the grieving process? Is there a light at the end of the tunnel with the grieving process? How do we know when we're done grieving, if you will, you know?
Well, you're naming the grief as a process, and it certainly is a process. And sometimes to understand grief, you have to understand kind of what we would call the stages of grief.
Okay.
So grief has 5 to 7 stages, depending upon who you read. But
Mm-hmm.
it is a process. The first stage is shock and denial.
Mm-hmm.
So in the loss of a loved one, we're shocked that they're gone. We're sometimes denying that they're really gone. It seems surreal to us. In the COVID-19 world, it's the shock that this was happening to us, that we were really in a pandemic. We kind of went through a stage of denial that this isn't going to last. And then that stage, once we move through that shock and denial stage, we start feeling the pain and sometimes the guilt of this that has been precipitated by COVID-19. The pain that this is here to stay, that this is interrupting our lives.
Yeah.
It's unbearable. Sometimes during this phase, this is when people turn to drugs, alcohol,
Mm-hmm.
healthy ways of dealing with things. And then sometimes the guilt of, I didn't get it, someone else did get it close to me. We feel some guilt, we call that survivor guilt in some ways, when we're not impacted by it, the illness, but someone else is.
Mm-hmm.
The next phase of grieving is anger and frustration. People have to find a way to mobilize their frustrations, and this gives way to anger. You may find yourself lashing out at people, blaming people. It's our way of trying to control what's happening, because COVID-19 has made our lives somewhat uncontrollable. This invisible illness is exerting a lot of control over us. And to get frustrated is normal and natural, and to get angry about that is as well. The next stage is the depression, reflection, and loneliness. This is where I think we are as a community, as the reality of it has set in, the shock, the denial, the pain of it, the anger we felt, and we're settling to just feeling a little down, a little lonely. And this again is these stages that I'm going through, Justin, are all normal and natural part of the grieving process. At some point, we will feel like we're reorienting our lives around this new reality of physical distancing and whatever else is impacting our lives in terms of as you said, the school routine, the decrease in gatherings of large groups of people. We start reorienting ourselves around that, and we start working through it. Kind of the last phase is we fully accept this new reality, these losses that are accompanying this new reality, and we start getting hopeful about what our new lives will look like. There's no returning to normal. People use the word new normal. I call it business as unusual. So that's a process that all of us at differing levels are going through, because we're realizing we've lost something. We're not going to return to anything that was familiar to us. It's going to look different, and to get a little depressed, lonely about that, angry. That's all normal. So that's kind of a quick version of the grieving process.
Yeah, that's, I'm sure several people listening can relate to at least one, if not the multiple stages. That's a really good breakdown of maybe from a community aspect, where we're going through and how we're going to get through this process. I did like that at the end of it, there's, you could kind of talk about it as a light at the end of the tunnel, where we don't stay in the lonely, depressive, or angry part forever, correct?
Well, yeah, you can think about, again, the loss of a loved one and death.
Yeah.
That is the frame for this. Hopefully at some point, as you miss them, as you are get angry that they're no longer there, that is their lack of presence in your life has changed your life, you get down about that and feel a little lonely without their presence, and you start moving out of that and the reality of living life without them.
Yeah.
You get hopeful. If you get stuck in any one of those phases and kind of stop living your normal life, that's when we say that grief becomes more complicated. Like when you stop eating, it interrupts your sleep.
Yeah.
People can confuse that with a depression or anxiety. It's really that you haven't fully grieved and you've gotten stuck in your grief.
You mentioned earlier a minute ago about a new normal. There's talk about, we've in this region here around where Wake Forest Baptist Health is, Dr. Chris Ohl, our infectious disease expert, he's kind of described it as we've crested onto this mesa. So it's not a sharp mountain, but it's a hill and then a mesa that's kind of a plateau, that we might be on this smaller plateau for a little bit, and it's not a mountain. And as far as the clinical cases and hospitalizations and all the updates that Dr. Ohl gives. So, there's been talk about reopening certain facets of business operations and government operations. But it is going to be a new normal, as you mentioned earlier. What, if we're kind of saying, okay, we can see the light at the end of the tunnel, the worst in this area might be close to behind us, or we're just now turning the curve possibly. How is this going to impact, or how might this impact people's mental health as we kind of go around the corner and we're on this plateau, this mesa, and there's talk of opening certain things at some point in the near future? How do we go through the grieving process to get to this new normal, and what does that look like?
Yeah. Justin, I think the reality of the past 5 weeks is that our nervous systems has been highly activated, and in some way our nervous systems have been on fire and dysregulated. I think we're starting to see, from a mental health standpoint, people's nervous system starting to come a little bit back to what we would call a new normal. And the way I'm experiencing that is people are it's kind of a letdown reflex, that your nervous system is not on high alert anymore. And we're in that phase of kind of the depression, loneliness, as people are really just exhausted right now. So if you're feeling very fatigued and exhausted, that's really part of a grieving process when you're absorbing the reality of what has happened, starting to process what that means for you, to be a little depressed, reflective, and feel a little lonely is normal. But I've also noticed that people are starting to feel some possibility of hope again and living their lives, getting back to a life that they once knew. And I think that's kind of where we're at in the grieving process, that we're at that kind of tired, exhausted, depressed, lonely, reflective stage. But as we get signs that things may be opening up, you'll start to see people's nervous systems settle out, become a little bit more regulated. I've started here in the department today, seeing people smiling a lot more. So I think there is some hope that is setting in, and some beginning to accept, okay, this is unprecedented, but there is, as you say, light at the end of the tunnel.
Yeah, that's a good word, Dr. Scoggin. I appreciate you kind of walking us through this idea of a grieving process, of how we work through the different stages of just how much our lives have been disrupted, and looking at what the future might hold ahead of us now. I've heard a term, psychiatric pandemic, and I've seen that maybe a couple of times out on the internet. And what are we looking at with what that means? What is maybe to come? Is there kind of a wave to follow after this major disruption of our lives, and as we try and get back to a new normal? The psychiatric pandemic, we recently saw that the Forsyth County government, they allocated $100,000 for local mental health services, because I think they see a need coming or rising here locally. Can you explain that to us a little bit, and what we can maybe be expecting, and are we ready for this?
Absolutely, Justin. We know from the disaster psychiatry literature that's been researched after natural disasters that really following something catastrophic like this, people kind of gear up to manage it and to live through it. But once that's in the rearview mirror, so to speak, the mental and bodily impact of that really sets in with folks. And so what we're planning for is this pandemic, yes, of psychiatric needs that will follow kind of flattening of the curve of this COVID-19. There's really four groups that I think about when I think about the psychiatric pandemic that's to come. The first group are those who, just by the nature of their constitution and psychological makeup, have been pretty resilient through this and will not really demand a lot of psychiatric mental health care. Their lives will proceed, if you will, somewhat normally. The second group I'm going to term the worried well. These are folks who, they function pretty well. This has kind of activated some anxieties and concern. They need a little support during this time and following. But they, over the next 6 months, will snap back to a more regulated state. The third group really is the group that's been highly impacted by this psychologically. This group probably had some vulnerabilities prior to this, both social, emotional, and they will become, if you will, kind of newly diagnosed consumers of mental health, and we'll see a rise in that. I know that last month the prescriptions for anxiety called benzodiazepines went up 34% in our country. So we know anxiety is certainly on the rise in our country, and this third group will be ones who will become kind of the new consumers, if you will, of mental health services.
Gotcha.
Fourth group is really those who already were suffering with mental health and substance use issues, and their conditions will worsen post-COVID, and they will need more attention and treatment. So that will extend, this pandemic will extend really for 6 months to actually years. That will be the after effects of this kind of catastrophic, unprecedented viral pandemic.
It's interesting, Dr. Scoggin. So as we see this mental health need coming for the next several months, I've heard Dr. Crystal use natural disaster analogies, and I've heard you reference them as well. And I think that's a good reference point for people to help understand kind of where we are. And we've experienced, though, if it's a hurricane or a tornado or a flood before, and this is, the feelings that we are experiencing are not dissimilar from going through something like that, major disruption in your life. As we go through this, and I appreciate you kind of helping us talk about identifying how that we are in a grieving process, and then we can help us work through the steps. So if someone, talks to you, or you're in clinic with someone and they're presenting with this situation, Dr. Scoggin, what do you tell them? How do you reassure them that this is going to get better, or how do you walk them through making progress to get to the other side, if you will?
Well, one thing that I do, Justin, is just to try to help them name what they're feeling, and to normalize that.
Yeah.
If you've never gone through this and you start feeling differently and having experiences that you hadn't had before, sometimes just to put it into a frame that normalizes it helps people. Some people will say, I feel like I'm going crazy, and I'd say, no, you're just grieving, and that's very normal. So normalizing is one of the things that I certainly try to do, and help people name and label what's going on with them, and to encourage them to take regular pauses when they start feeling a certain way that concerns them. What do I mean by pause? Kind of goes back to actually another podcast, to do that deep diaphragmatic breathing, to pause, to name what you're feeling, and actually just let it have its way. What we resist persists, as Carl Jung taught us many years ago. resisting what you're feeling and not being able to name it can cause further complications.
Yes. Well, I like that information, Dr. Scoggin. I think hopefully the people listening will find this useful. As we wrap up this podcast episode about grief and the grieving process and working through that, not dissimilar from maybe someone has experienced the loss of a loved one or gone through a natural disaster. Is there kind of a closing word of encouragement that you would like to offer to people listening, that have experienced, a heightened level of stress or anxiety, or maybe, as they're listening to this, they're identifying that, I have been going through this grieving process, and this is helping me, that I'm identifying this and naming it. What can we look forward to, Dr. Scoggin, as we go through, hopefully work through coming back into some of the quote unquote normal functions of our lives at some point in the near future. Even if it is a new normal, at least there's change on the horizon for us once again, as we try and integrate some of the more traditional processes back into our life. What is there a closing word of encouragement you have for us to help us stay focused?
Certainly, Justin, thank you. The first thing I would name is the worst thing is never the last thing. So we can certainly get caught up in this being a horrible shift in our lives and the impact it's having.
Yeah.
But remind yourself that those times when it felt like your life was coming apart and that you'd never recover, or this is horrible, remember those times where you recovered and it was not the last thing, that hope came again. You started living your life again. Because we've done that all of our lives. We just forget the small things where we've been maybe majorly disappointed, hurt, but we found a way to recover. Life always has a way. So the worst thing is never the last thing. And it's important, relative to the topic today, that you give yourself some grace and patience to go through this normal process.
Yes.
And if you find that it's interrupting your life in terms of, as I said, sleeping, eating, you can't concentrate well, then you may need to reach out and get some more focused and professional help.
Yes.
But if you're just in this kind of lonely, depressed place or angry place, that's normal. You're grieving. We're all grieving at multiple levels, losses that we feel right now.
Well, that's very helpful, Dr. Scoggin. And as we wrap up, I just want to thank you and just helping us to realize that it's okay to recognize and name these emotions, feelings, things that we're going through, and to normalize them and validate them. Hopefully people listening will find this very helpful. And I hope you come back and join us again in the near future, and we can talk about another interesting topic. So I know you're busy, but thank you for taking the time to join us today on this Best Health episode.
Thank you for the opportunity, Justin.
Yeah, and as we're wrapping up, I just want to invite everyone listening. This podcast will be posted on the podcast page and in your podcast store, along with all the other podcasts that Best Health has done, all the different episodes, and it's also available on the wakehealth.edu/coronavirus website, along with all the other COVID-19 related podcasts we have done for additional resources. So if people have questions, or they listen to this podcast and found it useful or insightful, and they want more information or maybe someone to talk to, you can definitely go to wakehealth.edu and get more information about how to contact us to talk to someone. You can also call 336-716-WAKE. Faith Health NC is another resource here locally that people can utilize if they want to learn more about this or talk about this with someone. So Dr. Scoggin, I appreciate everything. I hope you stay well, and everyone listening, until we talk next time, please be well.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu/besthealth and follow us on social media. Wake Forest Baptist Health. Care for life.